Mm-hmm.
Hi, my name is Dr. Tony Fedoryk with ET Chiropractic. We just want to go over a quick concept today that we use in chiropractic that is often pretty either poorly explained or not explained at all, and it's called the vertebral subluxation. Okay, subluxation is what chiropractors are actually adjusting when we're adjusting your spine. What the subluxation is it's a misalignment of the vertebrae, and it can happen either suddenly or over time. And that misalignment of the vertebrae can be a shift of the vertebrae out of its normal alignment. As it shifts out of its normal alignment, it's going to act like a dimmer switch on the nerve that comes out in between the vertebrae, right? So as we look at what the vertebral segments look like, is we have nerves running out from in between the vertebrae, and the subluxation can either be a large physical movement, or small physical movement, or sometimes it could be inflammation happening in that area that's going to disturb the nerve flow coming out between those vertebrae, okay? That vertebral subluxation in the spine will cause a compensation somewhere else in the spine as well. Okay, so if you have a misalignment in one area, your body is going to have to compensate in another area. That compensation is actually going to change the shape of the overall spine as well. And that can create a distortion in the shape of the spine. So here, if we take a look here, looking at the human body and how the nerves flow out in between the vertebrae, the subluxation in one area is going to act like a dimmer switch on that nerve. As you dim that nerve, you're going to decrease the signal out to that area of the body. So you might be asking yourself, well, what happens when you disrupt the signal that goes out to that part of the body? Well, it leads to weakness. Weakness over time leads to illness. Illness leads to disease. That subluxation that's there that we said it has a compensation in other areas of the spine as well, that can distort the shape of the spinal cord itself. When you're changing the shape of the spinal cord, you're actually going to cause a dam in the river of energy coming down. Because our brain is just trying to communicate with our body by sending energy down the spinal cord. So as that energy comes flowing down from the brain and exiting out these nerves, if you change the shape of the spinal cord itself, it's going to act like a dam in that river, not allowing that information to flow properly. Now the problem with the subluxation is it often happens with no symptoms at all. By the time you have a symptom, your body's already in a state of crisis and that nerve is inflamed. So our approach in chiropractic is, one, to treat your pain and your problem that you have, but to also find those subluxations that are distorting and interrupting your nerve flow and correcting those before they actually cause a bigger problem in your body. So that's what a vertebral subluxation is. I'm Dr. Tony Fedoryk with ET Chiropractic. We look forward to seeing you.